Hello, I'm Marsha Myrie, your health and wellness, lifestyle, and mindset coach. Welcome home. Well, today I'm going to continue the conversation on assessment. We've been talking about assessment and the purpose of taking an assessment, as you recall, is to take just a good hard look at yourself to determine where you are. Looking and doing a self-evaluation and to find out what's really going on in a particular area. Well, today I want to talk about a term in the medical field. It is regarded as assessing where you are health-wise and assessing certain areas to determine if you are at risk for chronic disease. And this term in the medical community is called metabolic syndrome. Now, there are 5 areas specifically health professionals are looking at and assessing. I'm using that word assessment because this is another tool in your toolbox. Last time we discussed SWOT, and the time before that, we looked at questions you can ask yourself. So there are different forms of assessment for various things. So today we want to look at the inner workings of what's going on the inside of you. What numbers will represent how healthy you are and how much of a risk you are for a certain chronic disease. So let's talk about it. And I have some notes here because I want to get the numbers right, because my objective here is not to show you how much I can memorize the numbers. It is just to encourage you to use this tool, Metabolic Syndrome Assessment, so that you will be motivated to go to the doctor. In fact, listen, this is what we're in the month of May. We're almost at the halfway point of the year. And I don't know if in January you paid attention to certain numbers or assessed other than your weight. Because most people, that's what they look at. How much do you weigh? But believe it or not, with metabolic syndrome, that's not what is being assessed. Because there are other indicators that are important. And so let's get into it. I know I had a thought and I kind of jumped around, but let me go back and finish that thought. The thought was, in the beginning of the year, you probably looked at your weight like most people do, and kudos to you if you have been assessing your weight week after week, month after month. I applaud those efforts because that is important. However, if you have not looked at what the medical community calls as metabolic syndrome, I'm encouraging you for the second half of the year. Let's see where you are. What if you were able to get into the doctor's office by the end of the month or in the month of June? We're talking about 6-week window of time for you to set an appointment and go to the doctors and see where your starting point is. See and make an assessment to see what's really going on with you. And then perhaps at the end of the month, at the end of the year, which would be in December, or even in January, go back to the doctor. That would have given you 6 months to make a change, make a difference. But let's get into what is metabolic syndrome. It is looking at your weight circumference. So how big is your waist? It is looking at your triglycerides. It is looking at your HDL cholesterol. It is looking at your blood pressure and your fasting glucose. So you are assessing those 5 areas, because if you have 3 of the 5, if you don't meet the threshold for 3 of the 5, unfortunately, you would have a diagnosis of metabolic syndrome. So that puts you more at risk for heart disease, for for stroke, and for type 2 diabetes. This is why making an assessment in those 5 areas are vital. We're not even talking about what we can do to address it, because believe it or not, the major risk factors, almost all of them, except for 1 or 2, can you control. Obesity is a risk factor, insulin resistance, sedentary lifestyle, those 3 you all have control over. Poor diet, you have control over that. Now, you don't have control over your genetics. That's a major risk factor. You have control if you smoke, and you don't have control of your age, because that is the whole idea. As you get older, the risk factor increases, and we want you to get older every year, but we want you to do so without metabolic syndrome. So as you age, and if you have metabolic syndrome, then that is a major, major risk factor. So let's look at some of the threshold. I'm gonna look at some of my notes here. For your waist circumference, if you are a man, your waist size should be 40 inches or less. And if you're a woman, 35 inches or less. So that's something that you can measure on your own. Just get a basic measuring tape, just get that from anywhere. A Walmart, they sell them, or Amazon. Of course, Amazon sells everything. So waist circumference. You could actually, if you have that in the house right now, you could do that today and get a jump start on making this assessment. You don't even have to go to the doctors for that. Your triglycerides, and what is that? That is fat in the body. Now, we all should have 150 milligrams or less, or so pretty much less than 150 milligrams. And optimal is suggested less than 100 milligrams. So depending on what study you read, and also depending on what your doctor says. Again, I'm not giving you any medical advice. This is standard across the board. If you go to the CDC or anywhere else, you can see these charts and these rates, okay? Now, your doctor, you'll have a personal conversation, and they will let you know what your targeted numbers should be. But I'm just giving you the basic information of what should be assessed. And so, again, 100 milligrams or less is optimized. Now, your HDL cholesterol, which is your good cholesterol, should be 60 milligrams or higher as a general. Now, they break it down, again, for men and women. Women, it can be 40 milligrams or higher, and for men, 50 milligrams or higher. But so if you do 60, if you can remember 60 milligrams or higher, then you're covered, okay? Blood pressure should be less than 120 over 80 millimeters. 120 over 80 millimeters should be less than that. If it's higher, you're in risk for hypertension, and we call that the silent killer, because sometimes there are not a lot of symptoms that go along with that. So you want to check that on a regular basis. And then the last is your fasting glucose levels. That's if you are not diabetic and if you're not on medication, it should be less than 100 milligrams. And so let's just, as a review, your waist circumference should be less than 40 inches if you're a man, 35 inches if you're a woman. Their triglyceride levels, which is the fat in your body, should be 150 milligrams or less, or 100 milligrams less is optimal. Your HDL cholesterol should be 60 milligrams or higher, and they break it down for the woman 40 milligrams or higher and 50 milligrams or higher if you're a man. Blood pressure should be less than 120 over 80, and your fasting glucose should be less than 100 milligrams. So if you are a person who resists going to the doctor for fear of getting your information, I encourage you to go know your numbers. All right, I'm going to stop there. Let me know down in the comments. Tell me if you have these numbers already, or if you're making that doctor's appointment so that you can assess your metabolic syndrome, because you do not want to be high or out of whack in 3 of the 5. You want to be below or not have any of them. That's the goal. And so remember that lasting change often begins with just one decision, and sometimes just one coach.